Dear friends, I am honored and very pleased to be here with you. We spent 3 fantastic days trying to find in these days the right way to cure the disease. I hope that it will be, this meeting, this workshop, also a great opportunity for each of you. We have also in Italy a foundation, and I will thank here my patient, Dr. Legnani, with his wife, because we would like to join you in this fantastic experience of the International Waldenstrom Foundation. So this is the start, I hope, of a way that we should have together versus the direction is the cure of the disease. I thank the organization, I thank Judith for these days. She accompanied us doctors in all these days, and I would like to meet you again very early. Thank you very much.
Well, welcome indeed to Venice, and welcome to this summing up. You will hear what has been achieved in these days. And a lot has been achieved. Researchers are doing advancement in the basic understanding of the disease. And this will open up really opportunity for a real treatment and possibly a cure in the near future. At the end of our talks, we used to thank patients, always. But that is not a formal tribute, it is a substantial tribute, because without your enthusiasm and participation in our research activities, we could not achieve anything. So your participation here is very important to us, in all aspects, I mean, from the scientific point of view and from the human point of view. And your Waldenstrom Macroglobulinemia community is an example for all patients' community, actually. Thanks to Judith and to her collaborators, Dr. Kyle is an advisor, but most of all, thanks to you. So thank you for your participation and thank you for coming.
Thank you very much, Guy. It's a pleasure to be here this morning and to see so many of you interested in this rare disease, Waldenstrom's macroglobulinemia. It's a pleasure to have Drs. Mora, Dr. Merlini, and Dr. Kimby right out here in front, and members of the IWMF. Now, I have a big assignment this morning, and that is to introduce Waldenstrom's macroglobulinemia to you. It's a challenge because many of you know a lot about the disease, but there are others who are less familiar with it. So please bear with me, and hopefully there will be something that will be of interest for everyone. I'm going to start first by talking about a condition called IgM, monoclonal gammopathy of undetermined significance, MGUS, MGUS, or MUGUS. And this entity is defined as a situation in which a patient has a monoclonal protein abnormality in the blood that is less than 30 grams per liter. As you will see on the slides, we use the designation that we use in the United States, grams per deciliter. 30 grams per liter. The bone marrow must, if done, must contain 10% or fewer lymphoplasma cells. The patient must not have any anemia related to the plasma cell condition. There must be no enlargement of significance to the lymph nodes, to the liver, and to the spleen, and of course, no hyperviscosity symptoms. In addition, the patient must have no constitutional symptoms, and by that we mean fever, night sweats, weakness, fatigue, weight loss. Now, this is a slide showing 213 patients that we identified in southeastern Minnesota as fulfilling the criteria for IgM-MGUS, and then we have followed these patients over the years. And as you can see, 17 of these patients developed a non-Hodgkin's lymphoma, and the RR, that is the relative risk, is increased almost 15 times greater than that you would see in a normal population as depicted by the SEER data registry. This is a national registry of 9 different areas throughout the country. This one is from Iowa, which is the state that's adjacent to Minnesota. There were 6 patients who developed Waldenstrom's macroglobulinemia, and the risk of that was increased 262 times what you would find in a normal population. As you know, Waldenstrom's is a rare disease. AL amyloidosis was increased 16-fold, and chronic lymphocytic leukemia almost 6-fold. Overall, these 213 patients, the risk of developing one of these diseases was increased 15 times above normal. Now, I want to go on and say a few words about the next step, which is an entity that we call smoldering or asymptomatic Waldenstrom's macroglobulinemia. These are patients who have a larger protein abnormality in the blood. As you can see, it's 30 grams per liter or greater, and or the patient has 10% or more lymphoplasmacytic cells in the bone marrow, but these patients still do not have anemia due to the bone marrow infiltration. Their lymph nodes, their liver, and their spleen are not significantly enlarged, and they do not have symptoms of hyperviscosity, and they do not have the fever, the night sweats, the weight loss, and so forth that is frequently associated with the disease. This entity, in our experience, accounts for about 20% at least of patients who present with, quote, Waldenstrom's. And the important thing is that this entity should be recognized, and these patients should not be treated until they develop organ damage. Now, here we see that a higher percentage of the patients with smoldering Waldenstrom's macroglobulinemia develop symptomatic Waldenstrom's or a related disorder during follow-up. At 3 years, 39% of the patients, almost 40%, have developed Waldenstrom's that requires therapy, and at 5 years, that figure is 55%. So it's roughly 10 to 11% per year will progress to develop symptomatic disease. This is in contrast to the patients with IgM-MGUS, in which the risk is about 1.5% per year. Now, please note on this slide that if you reach 5 years and you still have smoldering Waldenstrom's macroglobulinemia, the risk decreases and you are less likely to develop Waldenstrom's as time goes on. It drops back to 2 or 3%. So the longer you go, the better it is. And again, let me emphasize, these patients should not be treated until they develop symptoms. The take-home message from this portion is MGUS 1.5% per year, and that 1.5% does continue throughout the course of MGUS. The smoldering Waldenstrom's macroglobulinemia is approximately 11% per year, but these patients level off after 5 years and the incidence drops back. The progression rate drops back to pretty close to that of MGUS. Again, no treatment until the patient is symptomatic. Now, let's go back a little bit. This young man, age 38, described 2 cases in 1944 that fulfill the criteria of the entity that we're interested in today, Waldenstrom's macroglobulinemia. Jan Waldenstrom was a young, obviously very bright, young assistant professor at the University of Uppsala in Sweden, and Dr. Merlini is going to treat us this afternoon to a presentation on Professor Waldenstrom, who indeed was a unique and a wonderful individual. This is a picture of his first report of these 2 patients. He actually described 3 patients, but as we look back today, probably only